The cost of everything is going up. This includes the prices of prescription drugs. And sadly, this increase leads to many people not even taking the medications they need. David Harrell is the chairman and CEO of Transpare RX Corp. David, I briefly touched on it, but can you explain how these rising costs are impacting patients and the healthcare system?
Sure. Not only is it a major affordability issue, but it's really an outcomes issue. 30% of patients are not starting or staying on their medications due to cost. And that's affecting their overall health outcomes, increasing hospitalization, and even affecting them at work and productivity. So it's a major, major issue in America.
Well, tell us about Covered and how does that work overall?
So Covered looks at per individual user, their individual complexities and variables, such as do they have insurance coverage? Is it covered under their plan? If not, are there alternative medications that they can discuss with their doctor? And then take some, once that medication is chosen, to get them to the lowest out-of-pocket cost by using discount programs that are available, copay savings cards, and really anything that's available to get them to the lowest copay cost or out-of-pocket cost.
Right.
So today's world is very complex. Over the last 3 years, we've been taking all of those and we do all the work for you when you simply share your location and pick your prescription health plan if you have that available.
Okay, and do patients need insurance to be able to use this platform?
No, they do not. We can show them the lowest cash price available if they don't have insurance.
Okay.
But the unique thing about Covered, which is spelled C-U-V-E-R-D, the nice thing about it is it will bounce off the level of coverage that you do have if you do have insurance, and then see if there's other savings programs available for you to even further reduce your copay costs. So we'll compare cash pricing to your covered pricing and do all the thinking to get you to the lowest out-of-pocket cost at your local pharmacy.
Okay, and then how would this compare then to current prescription savings platforms?
Yeah, current prescription savings platforms are really addressed for that cash paying patient, which we do that as well. But again, they don't check the level of coverage that is available through your insurance and do the comparisons and then go to see if there's any additional copay assistant programs out there that can take your copay, let's just say from $60 down to as low as zero through manufacturer copay programs and other discount programs that we're connected and integrated right within the Covered app or covered.com website. For example, if you went to some of the other drug discount cards, you'd see that a branded medication for heart disease, for example, might cost you $600 a month, whereas Covered will look at the coverage to see if it's available and take it as low as $0 or $10. So it's a dramatic difference, particularly for those that have insurance. But again, even those that don't have insurance can at least get the best cash price.
I mean, who wouldn't want those savings, right? And so when and where should people use Covered?
Covered, of course, can be used at really virtually any pharmacy to show and make sure the savings are applied. But what's unique about Covered is it becomes a powerful tool that you should take to your doctor so that you can discuss, particularly when they're providing a new prescription for you, let me look, doctor, to make sure that product's covered under my insurance and what's the lowest out-of-pocket cost. Or if it's not covered, discuss alternatives that are covered so that they can walk away with the medications, knowing what the best price is and get them to start and stay on that medication.
Okay, well, I think a lot of ears perked up during this interview. So where can we go for more information? I'm sure our viewers are going to want to know.
Simply go to covered.com, which again is spelled C-U-V as in Victor, ERD.com to begin saving on your next prescriptions.
Well, thank you for telling us about this resource and helping us to save some money. And if you'd like to see this segment again, just head to our website at firstcoastliving.net.